the moment, and I'm wishing I did.
Yeah.
I'm not a pumpkin crazer, so.
Yeah, me either, but I see that's already on the market.
Good morning, everyone. Corey Portner, facilitator for today, just chiming in to let y'all know, just waiting on a few more of our panelists to join, and then we will begin. Thank you for your patience. Good morning and welcome to the Wednesday, September 15th, Washington State Department of Health Media Briefing. I'm Corey Portner, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Kristen Peterson, Deputy Secretary for Policy and Planning, Lacey Fehrenbach, Deputy Secretary for the COVID-19 response, Nate Weed, Acting Deputy Secretary for Emergency Preparedness, Resilience, and Response. And we're pleased to welcome Dr. Steve Mitchell, Medical Director of the Washington Medical Coordination Center and the Emergency Department at Harbor View Medical Center. To begin today's briefing, we'll open with remarks from Secretary Umair Shah.
Thank you, Corey, for kicking us off. And I want to start by thanking Dr. Mitchell for joining us today. Steve has been instrumental in our work with our healthcare system, with the Washington Medical Coordination Center. And I just want to thank you, Steve, for your continued partnership. It's been a long road over the last 18 plus months that we've been in this. And I also want to thank our team for joining us this morning. And certainly I want to thank our media partners and all of our community members. I'm going to just start by saying that, we continue to have a very serious situation in our state when it comes to our healthcare capacity. The state has done a number of things behind the scenes and continues to work with our partners, both at the Healthcare Authority as well as DSHS and other partners at the state level, along with our partners in the healthcare system, as well as in the local community with our public health partners to mitigate what's happening across the system. But the situation is serious, and we want to make sure that we give the right information and give accurate information to everyone. So with that, I'm going to those are my short comments right at the beginning. I'm going to come back at the end after Dr. Mitchell speaks. Let me turn it over to Dr. Scott Lindquist, and Scott's going to present some of the data so you have a better feel for what's happening across the state, both in the public health as well as the healthcare system. And then we're going to go through the additional speakers. Scott?
Yeah, thanks. I think the overall summary here is that we are at highest rates that we have been in this pandemic, both in cases and hospitalizations. And we have some statistics we can show you here with epi curves. So you're looking, what this again is an epidemiologic curve, and you can see the 5 waves that we've had during this pandemic. And the current wave is higher than it's been since the beginning. Now, the good news is we're starting to see some stalling out of this. I'm not sure if this is going to go in a downward direction now. That's really where we're at, wait and see. But it is the first good piece of information that we've had that we're starting to see some downward trend. I would be very cautious about this until we see this further. And a big message to everyone in Washington, we are not over this pandemic at all. We're at high levels. So that's encouraging, though, to see this stalling out. And the other thing to be concerned about is what is the relative risk between those who are vaccinated and unvaccinated for getting a case? And then, of course, that really depends on your age group. But as an example, if you're between the ages of 12 to 34, you're 30 times more likely to be hospitalized if you're unvaccinated. That's, again, 30 times more likely to be hospitalized if you're unvaccinated. So the evidence is really, really clear. We're at high rates of disease. We're at high rates of hospitalization, especially if you're unvaccinated. We have really tuned up our system for looking at vaccinated versus unvaccinated, and we will have a report on the website today that you can all look at, which really compares by age group the risk of getting disease, vaccinated or not, and the risk of hospitalization, vaccinated or not. The other issue is about variants. Everyone wants to know about variants, and we're in a pretty stable position where over 99% of our variants are the Delta variant at this point, which is driving a lot of this infectivity, giving us high case rates and giving us hospitalization rates that also show an increase, very much like the case rate. And many of you know our hospitals are really at capacity around the state. We'll talk more about that later in this discussion, but again, high case rates, high hospitalization rates, and we do follow our death rates, which are showing us a mild increase, but they're not as elevated as they have been. But again, we're watching this closely over time. And with that, that's the overall trends. If we have any slides on the vaccine versus unvaccinated, that would be great. We could show that. And this is really looking at hospitalizations in fully vaccinated persons, 6.5% versus 93.5%. So I don't know how best for all of us to share this with people that are unvaccinated, but clearly getting the vaccine is preventative for hospitalizations. And with that, I'll turn it back to you, Corey.
Next, we'll go to Assistant Secretary Michelle Roberts.
Good morning, everybody. I'm Michelle Roberts, and as you know, I lead the state's COVID-19 vaccine planning and distribution team. I want to start by taking a look at vaccination rates. So can we get the first slide pulled up, please? The good news is that vaccination rates continue to increase across the state. Hopefully we'll see that in the graphic in just a second. More than 4.9 million people have received at least one dose of COVID-19 vaccine, which is more than 75% of the state's eligible population. So can we go to the mountain graphic, please? Just wait here to make sure we've got the right graphic up. There we go. So as I was saying, more than 4.9 million people have received at least one dose of COVID-19 vaccine, which is more than 75% of the state's eligible population. So that is great success, and we're definitely seeing an increase in rates over the last few weeks. More than 68% of people 12 and older are fully vaccinated, protecting not only themselves, but their families and communities. I can't thank these people enough. It's time, though, for the 1.6 million others who haven't been vaccinated yet to head to the vaccine locator and make an appointment to get vaccinated today. I want to talk also about some of the common questions we're getting. The first is about vaccine boosters. Like many of you, we're patiently awaiting more information from our federal partners about when boosters may be available. While we know COVID-19 vaccines are highly effective at preventing severe disease, hospitalization, and death, even against the Delta variant, as the disease evolves, boosters could be a helpful tool to further protect people. The FDA is meeting this coming Friday and conducting an independent evaluation to ensure boosters are safe and effective. The CDC's advisory committee will then meet to review the findings and decide on clinical guidance for boosters. As soon as we have an update, we'll share that information with you. Another common question we're getting with kids back in the classroom is, when will vaccines be available for kids 11 and under? While we're hopeful the COVID-19 vaccine will be available for younger kids soon, right now we're waiting on guidance and recommendations from the FDA and CDC, and we have not been given a timeline. As we wait, let's continue to get our older kids vaccinated. Students aged 12 and older are eligible for the Pfizer vaccine. Getting everyone who is eligible vaccinated is one of the best steps we can take to keep our schools open and safe. The good news is there's plenty of vaccine available for everyone. And our federal partners have assured us they don't foresee any future supply problems down the road for Pfizer, Moderna, or Johnson & Johnson. Making a vaccine appointment is easy. You can visit our vaccine locator website or text your zip code to Get Vax, which is 438-829, or call the COVID-19 hotline at 833-VAX-HELP. Once you're vaccinated, you'll want to bring your vaccine verification with you when you leave the house. You may need it when you go out to eat, when traveling, or when you cheer, or even when you cheer on the Seahawks. If you lose your vaccine card, you can access your official state vaccination records online at myirmobile.com. It's important to do this ahead of time because you may need assistance to match and connect to your information in the system. If you need help, call our COVID-19 hotline at 833-VAX-HELP. The hotline has trained specialists who can help access your MyIR account and get you connected to your record. And last but not least, it is that time of year again. The start of flu season is right around the corner. Annual flu vaccinations are recommended for everybody aged 6 months and older. Although flu cases across the nation were low last year, with more people returning to their daily activities, this flu season could be much more typical. September is a great time to get you and your family the flu shot, especially if you're at greater risk. Science continues to show that vaccines are the best tool we have to protect our communities and slow the spread of COVID-19. Let's encourage our family and friends to get vaccinated today. If anyone has questions, visit DOH's frequently asked questions page or reach out and talk to a trusted healthcare provider about the vaccine. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Deputy Secretary Kristen Peterson.
Great, thank you, Corey, and good morning. I want to first acknowledge and thank the tireless work of our healthcare workers across Washington State who've been providing care throughout this pandemic and making sure patients across Washington State are cared for. Our healthcare system, as mentioned, is experiencing extreme stress and capacity issues. Corey, if you could bring up the slide showing COVID admission rates, that would be great. Unfortunately, this stress could continue or increase in the days and weeks ahead. Next slide. I'll continue as the slide is being brought up. I do want to share that we're monitoring the situation closely within DOH and with our healthcare partners and making efforts to mitigate what we are seeing. Next slide, Corey. DOH is engaged in public health efforts, first of all, to curb the spread of the disease, to avoid hospitalizations. Here we go. This is the slide I was looking for. It shows COVID-19 hospital admissions, and you can see the steep increase. And while the appearance here may be that it's plateauing or leveling off, occupancy in hospitals across Washington state is still at an overall high. So in addition to mitigation efforts with our healthcare partners that I'll go into in a moment, we are working on public health efforts to curb the spread of the disease, to avoid hospitalizations to begin with. And this includes providing isolation and quarantine services, case investigation and contact tracing, and issuing public health measures such as masking requirements. We're working closely with our state, federal, and private partners to mitigate the stress on the system by accessing additional volunteer and contracted staffing resources. We're coordinating information sharing, and we're supporting efforts to shift patients from hospitals to the community setting when they no longer have a medical reason to be in a hospital. We're working closely with our sister agencies, the Healthcare Authority and the Department of Social and Health Services on this effort, and I want to commend them for their efforts. It's a multi-factored approach. For example, Department of Social and Health Services has brought in strike teams to augment staffing in long-term care facilities to help this effort. In addition, we are working to free space and staff within hospitals by finding alternative places to administer monoclonal antibody therapy, which is currently happening primarily in the hospital setting. This therapy for COVID positive individuals helps lessen the severity of the disease, which could also help avoid hospitalizations. We'll continue to work to mitigate hospital stress. We have multi-agency coordination meetings, if not daily, weekly, and we are relying on the collective efforts to mitigate the situation. Our overall goal is to ensure that those who need care the most in Washington continue to receive it. We also encourage healthcare facilities, providers, and local health jurisdictions to continue to work together at the local level to mitigate effort. We are in this together and all play a really important part. So thank you, Corey. With that, I'll turn it over to the next speaker.
Thank you, Deputy Secretary Peterson. Next, we'll go to Director Steve Mitchell.
Hi, good morning, everybody. Thank you for the invitation. Appreciate the chance to address everyone. So our hospitals remain under significant strain, as has been commented on already. Today, there are 1,592 COVID patients in our hospitals in Washington state. For context, that's roughly the equivalent of 4 Harborview medical centers where I practice medicine, spread out throughout the entire state. And I would like to say that we really do all have a common enemy, and the enemy is COVID. And so my plea is that we all put on our defenses and fight this common enemy, as we always have in this country. The front lines for this battle with this common enemy is our hospitals, and they are overfull. All of our resource hospitals, all of them are over capacity, every one of them, and they are spread throughout the entire state, east and west side. So what does this mean for our fight against this common enemy? It means that our resource hospitals in places like the Tri-Cities and Wenatchee and Everett and Vancouver, as well as Seattle, all of them are going to incredible lengths to care for their patients. They are doing things like turning areas not meant to be taking care of critical care patients into ICUs. They are also taking staff who normally don't work in intensive care units, and they are extending the staff that are who normally work in critical care units They are extending them, trying to increase their reach so they can care for yet still more and more patients, putting increasing strain on all of our staff, all of our nurses in particular, and our respiratory therapists. And when our ICUs and our alternative ICUs are full, what then happens after that? Well, they back up in places like our emergency departments, and those same emergency departments are unable to move their patients through into the hospital where their patients are best cared for. And so the trickle down impact from that is sadly that the patients wait for great periods of time, long periods of time, hoping and waiting for a bed while in the emergency department. Meanwhile, the ambulances still keep coming, and our waiting rooms fill up to levels that none of us who work in emergency medicine are comfortable seeing. And those same ambulances are unable to offload their patients into our emergency departments. And so they then become unavailable at times to respond to 911 calls. When I left the hospital late last night, my emergency department had nearly all of the patients that I was taking care of that needed to be in the hospital were still waiting in my emergency department because we were unable to find a bed. And I want you to hear this. This is not just my hospital. This is happening in every resource hospital throughout our state. It is a common problem that we are all facing. So since July 1st, my team at the Washington Medical Coordination Center has dealt with over 1,000 requests from hospitals who have been unable to place their patients. They have tried, but they have been unable to move their patients from these small rural critical access hospitals where they can stabilize patients to the locations that can actually intervene and fix those patients. And for example, just yesterday, there were 2 patients who both had significant and severe COVID who showed up to a small critical access hospital in the very northern central part of our state. And after many hours of searching, the place where we found that could take them, that could accept them for care, were in King County. And so that meant taking an ambulance far outside of their geographic area that they serve, and it also meant all the impacts on family and all their loved ones, because now their loved ones are being moved many, many hours away from home. And so also, as I left the emergency department late last night, I was struck by a conversation I had with one of my critical care colleagues who has been taking care of COVID patients all week long. And he was just mentioning randomly, he goes, "I'm so sad by the reality of what we are seeing, which is the younger age of the patients in our critical care units." And he went on to describe four people who had COVID and that were in their 20s that he was taking care of this week, one of whom tragically died, one of whom is now on a bypass machine called ECMO and is remarkably ill, and the other 2 who are having to receive their care while upside down, while prone, because it takes pressure off of their lungs in just a remarkably uncomfortable position while they're already severely sick. And he mentioned in follow-up also that sadly, 3 of those 4 were not vaccinated. And the one person who was vaccinated was significantly immune compromised, was taking medication that suppressed their immune system's ability to respond to the virus. And so I want to plead with people to please fight our common enemy. And that common enemy is COVID, and to use those defenses to fight our enemy, which are vaccines, which are face coverings, and which is when you are in a crowded location, in particular indoors, that you distance yourselves. So thank you very much for the opportunity to share again.
Thank you, Dr. Mitchell. Next, we'll go to Secretary Mayor Shaw.
Thanks, Corey. Can you hear me okay?
Loud and clear.
Great. Well, I want to just underscore what Dr. Mitchell just said. And before we go to Q&A, I did want to bring a few things back into focus here. First of all, as we've been saying, that this is largely something that we can all work together to prevent. our healthcare system, and even supporting our healthcare workers who have been working tirelessly throughout this pandemic, in addition to our public health system and the workers there. The system is stretched, it's strained, it's stressed, and we have a real challenge here. What we are doing appears to be working when people are wearing masks and people are getting vaccinated and they're avoiding crowded situations. Those are the kinds of things that are helping see that flattening that we're starting to see, but it is well too early. And I think it's important for us to keep in mind the couple of metaphors here. One is a rubber band. When you have a rubber band and a system, just like a rubber band stretches, there comes a point where that rubber band just cannot take it anymore, and it simply breaks. And that is the concern that all of us have. The other is that though we're maybe starting to see the flattening, as Dr. Mitchell mentioned, one of the concerns is that we're at a significantly, severely high number. And this is really critical as well. It's the equivalent of driving on a freeway. When you're driving on a freeway and you have the accelerator pressed, and all of a sudden you let go of the accelerator, it does not mean that your car immediately stops. Your car will continue at a certain speed for a while coming. And that's going to be a real issue that we have in our healthcare system, is that we're going to continue to see whatever inputs, whatever patients that are coming will continue to stress that system for some time moving forward. And I think that's really critical for us. We're getting a lot of questions about crisis standards of care. I want to clear up some of this potential confusion that may be out there. Crisis standards of care is a very specific term. It is a term that is very much meant to be the last resort when life-threatening or life-saving both medications or therapeutics or ventilators, you just don't have enough of them. And you get to this point where you have to ration the care because you don't have that life-saving or what prevents you from life-threatening acute illness or some condition, that you don't have enough of that. And that is what is different than what we're seeing today in our system. Today in our system, we're seeing care that's being provided within a crisis, care that's being provided during a crisis. That does not take away from anybody in our system who is doing heroic work to handle the load of people that are coming into our healthcare system. But it's not enacting what this specific term of crisis standards of care would mean. We've seen, for example, in Idaho, that term being used. We've been seeing it across the country. We're doing everything we can, along with our partners, governor's office, our HCA partners, or DSHS partners, Dr. Mitchell at WMCC, and all of our healthcare partners, including with the Hospital Association and our local public health partners. We're doing everything we can so we don't stretch that system to the point that it breaks, and we have to implement crisis standards of care. So our goal is not to get there. This is largely preventable. This is about wearing masks. This is about getting vaccinated. This is about doing the things that are going to help us prevent further input and influx into our healthcare system. So as Dr. Lindquist did and Dr. Mitchell did, let me join in saying, I'm coming at this not as your health secretary, I'm coming at this as a physician, as a doctor. What I'm asking you to do is please help us in fighting this in our communities. This is not about a political stunt. This is not about a governmental overreach. This is about the fact that we have people in our system who are going to die, who are going to have severe illness, who are going to be on ventilators if we are not doing what we can do. Dr. Lindquist showed that if you are vaccinated, you are markedly more likely not to be hospitalized. In other words, if you're unvaccinated, you're markedly more likely to be hospitalized from COVID-19. The choice is ours, and it's up to us. As I mentioned during the press conference from with Governor Inslee last week, my daughter turned 12 on Thursday, and I had mentioned that we were going to get her vaccinated, and we did get her vaccinated on Friday. But what happened is when we went to get her vaccinated on Friday, I ran into a woman who was also getting vaccinated. She was actually getting vaccinated because she wanted to attend the Seahawks game. But it was interesting, we had this discussion. And she said, you know, all the times that I see you, I think of you as somebody who is just, you know, another one of those people talking about what needs to be done. But after talking to you here one-on-one, I realized that you are a physician, you are a doctor, and you do care, just like Dr. Lindquist does, just like Dr. Mitchell does, and just like all of our team members here, as well as healthcare workers across the system. It is really important for us to remember that we're not coming at this from a bureaucratic standpoint. We're coming at this from the standpoint of medical health and protection. We are trying to protect as many people from severe illness and death. And we want to have you help us do that. So I plead with you, just as my colleagues have, I plead with you to do everything you can to help us protect our healthcare system. I know it's challenging. I know it's tough. I know we keep saying that it just hang on a little bit longer, but the truth is this pandemic has been a really difficult pandemic to fight, and we cannot do that unless we do it together. So with that, I want to thank all of you, thank our media partners again. And Corey, with that, I'll turn it back to you so you can go ahead and get us through our Q&A.
Thank you, Secretary Shaw. This, of course, brings us to the Q&A segment of today's briefing. To begin, we have Ariel with the spokesman.
Great, thank you. I'm curious, Dr. Shaw, if you could explain a little bit of how crisis standards of care could be declared in Washington. I'm not sure if that would be a regional or a statewide declaration, or if the Department of Health would do that at the request of a specific hospital. Thank you.
Yeah, Ariel, thanks for that. You know, I will tell you that there are a number of ways to look at this, but I'm going to just give you the way that we have envisioned this working. Now, I will tell you right off the bat, there could be some modification of this because during this pandemic, some things have changed over time, and we want to make sure that we're careful that as things change, that we are able to address the situation as it comes up. But the number one thing that I would say is that we would have, and we do have, a number of healthcare partners, as mentioned, with WMCC and our hospital healthcare partners, as well as our coalitions, the Northwest Regional Hospital Network, as well as the healthcare network, and working together. They are part of, members of the groups are part of a DMAC, Disaster Medical Advisory Committee. That DMAC is made up of experts across the state. What they would, and they have been doing, is meeting and deliberating and looking at all the different numbers, making an incredible amount giving an incredible amount of input into the system and how to address what's happening within the system. When that DMAC group comes together and they see what's happening across the system, and there's two things they're looking at. One is the saturation within the actual healthcare system. The other thing they're looking at is the inability for resources to be moved back and forth, or patients to be moved back and forth. So for example, as Dr. Mitchell's group, WMCC, transfers patients across this, if you can no longer transfer patients across the state, or you cannot get resources into a hospital that is severely stressed and exhausted, that is when the DMAC would make a recommendation to the Department of Health that we believe that we are getting close, that we are at that point where we may need to pull the trigger on enacting crisis standards of care. Then our team would review that and talk to DMAC and WMCC and other partners and make sure that we have confirmation that there are no other resources that could be given to that region, that community, that hospital, that individual institution. And then that would come to the leadership, that would be me as the Secretary of Health for the state of Washington. And I would then be in discussions with our team as well as our partners, and obviously with the governor's office. And we would then say, yes, it looks like we do not have, after looking at everything else that's there, including federal resources, we have no other way to bring resources to bear. And at that point, we would call a statewide crisis standards of care. Now, could it happen in a scenario where it would be in a region like Idaho did? I don't think so. And what I mean by that is that obviously I don't think Idaho thought that they were going to do it that way either. So I'm never going to say never, but I would say that that is not the intent of crisis standards of care. The crisis standards of care and the theory behind this across the nation with the National Academies of Medicine, National Academies of Science, Engineering, and Medicine, NASEM, is that it is supposed to be for a statewide declaration. And that is the way, the concept that we're working from here in the state of Washington, that it would be a statewide declaration. Why is that important? Because if it's an institution or a community or a region, then guess what? If you have another region right down several hundred miles away that still have resources or the ability to transfer patients, then you should be able to move across the system. That's the way the system is supposed to work. That's why in an individual hospital, they may be providing care within a crisis or crisis care, but not to the level of crisis standards of care. There's a specific distinction. I wanted to make sure to highlight that, because if a hospital calls it, we're going to pull the trigger on it, and 10 miles down the road, another hospital could easily have provided resources or taken some of those patients, then that hospital may not have needed to call that. And that's why it has to be a large swath of land like a state. And that's where our Department of Health position has been throughout. I hope that helps, Ariel. Corey, before you move on, I want to make sure that covers Ariel's question.
Yep, no, thank you. That was great.
All right, Corey.
Our next question comes from Steve with Como.
Hi, Corey. Thanks very much for taking the question. It's another crisis standard of care question. And first off, I want to ask, at what point do we expect to see a real significant impact from the current vaccine and mask mandates on the case and hospitalization rates? I know we're starting to see signs of a flattening, but could the situation actually get worse? And I realize we haven't reached the point of crisis standard of care, but I think a lot of people are trying to figure out how close are we to that potentially. I think what the State Hospital Association said earlier this week is that we're dangerously close to it. I'm curious if you could provide some input on that. Thanks.
Yeah, Steve, I'm going to take a stab at that. Then I'm going to turn that over to both Dr. Lindquist and Dr. Mitchell. I think they can weigh in as well as anybody else on our team. What I would say is that it's not easy to say how close you are, because really there are a lot of moving pieces. It's about patients, it's about individuals that are coming into a system, it's how long they're staying within that hospital system, it's how do you discharge them or transfer them somewhere else once their care is completed. It's that if you have a hospital or set of hospitals that are stressed, can they have fellow hospitals that can carry the load, what we call load balancing, if you will. There are many things that go into this, and certainly the actions that you talked about when it comes to masking and comes to vaccinations, that absolutely helps. So the policy decisions that we make, for example, masking or saying you need to do the following things in certain settings, or encouraging people to be safe as they're going about their actions, which, as you know, we did at Department of Health prior to Labor Day. Every action typically takes, whether it's good or bad, takes 2 or 3 weeks to start to see some of the impact of that. Vaccines will take longer. Why? Because we know you start vaccines, unless it's J&J and you get, 2 weeks later, you get full protection. You're talking about 3 to 4 weeks plus another 2 weeks. Now you're talking about 6 to 8 weeks before you actually start to see the impact of vaccines. So that's why vaccines is a little bit of a slower dial, but incredibly effective, because it's a longer lasting and markedly more effective strategy. Whereas you have obviously masks and other non-pharmaceutical interventions, we call them, those are interventions that take 2 or 3 weeks. Now, we also have Labor Day on top of that. We have schools that have restarted. So we've got a lot of things that are moving the dial in a number of different ways. So I don't think anybody can say, as you said, the Hospital Association has said that we're very, very close. I'm really concerned that we have stretched this rubber band And at some point, that rubber band is going to break if we do not continue to keep up with what we can do to prevent people from getting into that healthcare system. Plus, we have an issue of staff shortages. And that is a key piece right now that's happening as well. We're doing everything we can. We've already put a request in for 1,200 personnel to help our healthcare system. I'm anticipating that kind of continuation of staff support is going to be necessary, because our healthcare workers are truly stressed right now, and we got to do everything we can to help support them, and also to fill some of those vacancies that have been in place for months. So Dr. Lindquist, Dr. Mitchell, anything you wanted to add on that?
Yeah, thanks. No, I think you covered it very well. The only thing I'd really like to take some time is to recognize our colleagues. So this is the ICU nurse, this is the med tech, this is the physicians, this is everyone in healthcare, that we really appreciate the passion you're showing. We know you're exhausted, we know you're stretched, we know that you're getting criticism for healthcare and decisions, but I just want all of you to know that we at DOH and everyone on this phone or interview really appreciate everything you do. I would take each of you out for a pumpkin latte if I could. And maybe at the end of this, we'll have some way to recognize you. Please keep the faith. Please understand you're doing good work. And I'll leave it at that.
Yeah, and I would just add just a few comments. One, to illustrate the stretching that Dr. Shah mentioned, I agree. That rubber band is tighter than it has ever been before, but I agree, we have not snapped that rubber band. We have not moved into that place where we need to declare. But in a primary limitation point that has been mentioned is our staffing. And every day I go to work, every nurse and every respiratory therapist I encounter, I literally say, thank you for coming to work today. That is the place we are at with our staffing, because it is a conscious decision to show up to work, because it has been remarkably challenging and hard for all of our healthcare workforce. And those challenges are not only stretching that rubber band, but they are limiting our ability to surge and to do a lot of the things that we had always planned on being able to do when we think about pandemics and these types of surges and our crisis standards of care conversations. And so, Scott, I will join you in buying as many people as we can possibly can pumpkin lattes or a beverage of their choice.
Now I'm craving a pumpkin latte. Our next question comes from Nicole, Cairo Radio.
Good morning. We're hearing from people, even people with symptoms, who can't get a test, especially in places like Pierce County and Skagit counties. So are individual counties or cities putting any restrictions on testing? And how are they going to help people who need to get tests, for example, who may be asymptomatic but might need to get tests for work or for travel? And then my other question is, could you give an update on the status of the Mu variant?
If I can have Lacey, if you could cover the testing, and then Scott, you want to talk about Mu after that?
Yeah, good. Thanks for the question, Nicole. We're not aware of any official policies on limiting testing. I did put into the chat for our team the link to the testing locator that the public can use to find testing near them. It's on DOH's website. You go on there, find your county. There are a number of places that do require appointments. There are also some places that are drop-in or walk-up. So we are aware that there are waits to get appointments in some locations across the state, or long lines at some of those walk-ins. And this, you'll recall, this happened in the fall as well when we had really high levels of disease. And I think it's important to help people understand, like, when we get to this level, all of our systems get stretched. We're all facing staff shortages, and the people that administer tests are similar people and types of healthcare professionals that administer vaccines, and they're the same folks that work in our hospitals and our clinics across the state. So, the best thing we can do to help across all of our public health and healthcare system is get our disease levels down. And that's, those are those policy interventions that we talked about in response to Steve's questions, but it's also other things that we can all choose to do, like limit our gatherings, or if we gather, do them outside, avoid large crowds. All of these things collectively lower our risk of getting COVID, so ourselves, our families getting sick, but they also reduce the risk of an opportunity for spread across the state and in our communities, and will help get more capacity in our healthcare system, which I think is our biggest crisis at the moment, but access to testing. The other thing I wanted to note is there are a number of tests now available to be done at home. You can pick those up in your local pharmacy. You can also order some of them online from online vendors. So those are rapid antigen tests that you self-administer at home, and that's a great resource for families to have on hand. I can tell you my family has some sitting over on the counter over there. So lots of evolution in this space.
Yeah, and I can address the issue of the new variants. So like I said earlier, that 99% and even more as the days go on are the Delta variant. That doesn't mean that we don't see other variants, but it means that those variants are altogether less than 1% of what we're seeing in Washington state. We are looking at Mu, we are looking at Lambda. They are not required to be monitored by CDC. WHO says they're of interest or of concern, but we are not seeing many of them here in Washington state. This Delta variant is so superior in being infectious that it's outcompeting every other variant. It is amazingly infectious. That's why it's so predominant. It doesn't mean that the Delta variant is more deadly or more virulent. It just means it is so much more infectious that nothing else is competing against it. We do have a very aggressive genotyping program in Washington state, one of the top in the country for looking for new variants. So if we start to see an evolution of one of these variants, we will be one of the first states to see it. Reminder, we were the first state to find the first case of COVID in the United States. We have that same spirit to look for any new variants. Turn it back to you, Corey.
Our next question comes from Jake at King 5.
Hi, all. Thanks for holding the briefing again. A couple quick questions. How concerned are you about outbreaks and the spread of the virus in our nursing home facilities? And on the back to that question, how concerned are you about unvaccinated workers at these facilities? Also, are you seeing any sort of impact on the vaccine mandate on our vaccine status this morning? Thank you.
Yeah, I don't know who wants to take. There's a number of questions that Jake, thanks for asking. I would just start that, with the vaccine requirements, I think it's a bit early because we're obviously still a month away from the October 18th timeline. But I will say that we have seen an increase in vaccines overall. Michelle may have the percentages, but at last count, I was seeing 30% increase over previous weeks. So we are seeing some increases across. Now it's hard to know how much of that is related to vaccine requirements, vaccine encouragement, concern about Delta strain, or all the above. And I would say it's probably all of the above. But I will say that one thing that we've consistently said from the state level is that vaccines work, and we are encouraging everyone who is eligible to get vaccinated. Like I said last week, my, at that time 11-year-old, she was, for her birthday, wanted to get vaccinated, and she did. she did the right thing. And that's great to see. We want to get other adolescents. We certainly want adults. We want all people who are eligible to get vaccinated. And that's really important for everything we're seeing. So Michelle, I don't know if you have any specific numbers outside of the 30% or so. And then Lacey or Kristen, maybe you can address the other questions that Jake had.
Yeah, I'll just say Dr. Shaw really covered it. It is depending on what weeks you measure for, but rates were down, vaccination rates in July, and we have seen a 20 to 30% increase since then. So obviously there's probably multiple factors, but the vaccine requirements are probably part of that, along with just the high levels of disease. We always see an increase in vaccination anytime there's high levels of any disease. It really changes people's, we would prefer they get vaccinated before there was high rates of disease, but I think people, their risk level changes and they're more likely to take action. I'll also just add, we are concerned about healthcare workers being unvaccinated in any setting where there's a lot of people gathering. It is a risk, and we know there's documented cases of transmission to patients. And I know people may have questions and concerns about vaccines, but I also know we want to do everything we can to protect patient safety in those settings. And so we are concerned when there are high levels of unvaccinated healthcare workers, which I think was part of the governor's decision making in the vaccine requirements.
I might just add that if I may, that we do need to be concerned about outbreaks in skilled nursing facilities and in long-term care facilities for a couple of reasons. Not only because they are some of our truly most vulnerable populations, as we have learned since literally day one in this pandemic in our state, but also because the healthcare system is a continuum of care. And we desperately need the availability of those long-term care facilities to be available to receive patients as they no longer need hospitalizations to relieve the strain on our hospital system. And so I think we need to be laser focused on making sure as many of those facilities are as operationally capable to receive and to care for those very vulnerable patients.
I think that folks on the call have covered this well. I think the other thing I would add is in these congregate settings, healthcare, schools, correctional facilities, the risk for an outbreak increases when disease levels are this high. So, we are extremely concerned about them right now. And that's why you're hearing about all of these measures we're taking, including requiring vaccinations and, load balancing among the continuum of our healthcare system becomes extraordinarily challenging when there are outbreaks in either situation, the hospital system or a long-term care facility. So it is something we're paying a lot of attention to and working really hard to mitigate when they happen and prevent from happening in the first place.
All right, we have a number of other reporters in the queue, so moving along, we'll go to Jessamine with Q13. Jessamine, do we have you? We'll move on and maybe circle back later. Go to Allison with Cairo.
Hi there. Thank you for taking our questions. I wanted to ask you about pregnant women and COVID. A local area doctor in Seattle posted that she had social workers crying because pregnant women are dying in ICU and they're delivering their babies by a C-section at 24, 26, and 28 weeks. That's the situation at one hospital. I'm curious if there's any stats in our state about pregnant women, and I reached out to you through email as well, or if any of these doctors can talk about what they're seeing or what women need to know.
Thanks, Allison, for that. And I don't know if anybody that's on, if they have any statistics, and certainly would be interested to hear from Dr. Mitchell as well on this one. What I would say is that we are anecdotally across the country actually hearing of pregnant women, some who are not vaccinated, unfortunately, who are now in a very serious situation with both their baby as well as their own health, and that is heartbreaking to all of us, because we know that these are pregnancy in and of itself is a challenging time, but it's also even more so when you have a preventable vaccine that can help a pregnant woman and the baby from COVID-19. And so we're really very much focused on getting the word out to pregnant women to talk to their OB, their obstetrician, or their provider to make sure that they have the discussion about COVID vaccine and how critically important it is for their health and well-being. So I don't know if Dr. Mitchell, you had anything additional to that, or if anybody on our team has anything else in terms of statistics.
I don't have any specific statistics other than to say we are concerned at the Washington Medical Coordination Center. We are monitoring that and in our data gathering, and we have not seen an uptick in those 1,000 requests that we've received since July 1st at the Washington Medical Coordination Center for hospitals. We have not, I don't believe we have had a request since the early part of July involving the scenario that you pointed out, Allison. So that's great. That's great news. It doesn't mean that it's not happening. And I have heard the anecdotes similar to what you described as well, but I don't have any specific details on that. I think we can safely say in medicine that we have, since the pandemic began, we have learned that vaccinating pregnant women is remarkably effective and very safe also for the baby, and to prevent a lot of these things from happening.
The one thing that I can add, Allison, the CDC does track data on pregnancy and COVID-19. We can get you the link to that. And the other thing I would add is we have been doing a lot of messaging and using trusted community voices and healthcare providers around the importance of pregnant women getting vaccinated and the risks of COVID-19 to people who are pregnant. So it's a great question and something we're certainly paying close attention to.
All right. Our next question comes from Jessamine Q13. Give it another go.
Hi, I do apologize for the connectivity issues earlier. I wanted to focus a little bit on schools. I know that Dr. Shaw and Lacey Fehrenbach have both expressed the importance in in-person learning, as well as, you're sending your own kids to school, which is encouraging. However, that should encourage the public. We're about at that point where next week we could see some fallout, and we're hearing from parents on a daily basis that there's an outbreak in their school. I'm sorry, not an outbreak, but a case and a case and a case. And at what point do you think that we could really end up back in remote? And would you recommend it? At what point would you recommend we go back to remote learning?
Just very quickly, Jessamine, thank you. And I'm glad you had technical issues, because usually it's just me that has them. Dr. Lindquist has been meeting with local health officers across the state. And really this very question about at what point do we make a recommendation that a school would either need to close, or a classroom would need to close, or would need to go to virtual learning. And so we would certainly encourage, working with OSPI, encouraging virtual option backup. That should always be there in this very difficult time during this pandemic, where we just, you can never say never when it comes to the path forward. There's always a meandering path forward, which unfortunately gives people more consternation, but that's the nature of viruses, right? You can't always predict. What I would say is that we're looking at a number of factors, which includes the number of cases that would be linked to each other within a classroom, or the number of cases that are linked to each other within a school, and then making a decision based on the number of cases linked to each other on whether that is a true outbreak, or if there are two individuals that, you know, are across the, you know, the school that are still 2 cases or 3 cases or 5 cases, but it's not a true quote unquote outbreak linked to each other. So there are just a number of factors that go into it. But what we have been doing is planning with our local public health partners across the system, and then working with our OSPI partners at the state level as well. I think it's critical that we want to continue to maintain kids safely going to school in person as much as possible, everywhere that's possible. And that's why, as I said previously, 2 weeks ago, talk to your kids, you know, make sure you emphasize, we do this every single day, you know, make sure you emphasize, look, wear a mask, and I don't care what the Johnny or Susie across the classroom is doing, or what's happening at recess, you are going to wear a mask and you're going to do the right things. And certainly with our daughter getting vaccinated, the other thing is, you know, for kids who are 12 and up to get vaccinated, and then modeling those behaviors as parents. I mean, kids are not going to listen to us if we ourselves are taking risky behaviors and risky risk, and then saying to our kids, hey, listen to us, but then we're not walking the walk ourselves. So what's happening is really a reflection of all of that together. We are looking and working with WMCC and our partners around pediatric capacity. That is, as you know, very challenging across the state, because our pediatric capacity is not as robust as we would all like to see. And so over time, we've got to do everything we can to prevent kids from getting sick in the first place. Scott, anything you want to add on that one, or does that cover it?
Yeah, I mean, I think you covered most of it. The one point is something you touched on, which is when we look at these cases in school, these are not big super spreader events. They're not large outbreaks. So that is really a testament to the control and structure that's in the schools. So doing attestation when you come to school, if you're sick, you really shouldn't be there. If they are symptomatic or sick, getting them tested, and then having good isolation and quarantine workups through the school. That is what's really limited these numbers of people's involved with a case in the school. And that has been very helpful.
Great, thank you. Corey, how many reporters do we have in the queue? We're at the hour, so I want to make sure that we're, you know, trying to wrap up, but also cover as many as we can.
Yeah, so we have 3 reporters left in the queue. Our next question comes from Elise. I think we can run over just a bit for panelists that have to hop off. We'll make do, may need to follow up in writing. But next question from Elise with Seattle Times.
Hi, yeah, thank you all so much for being here. I'm wondering if more clarity can be provided around the vaccine exemption process for state workers and enforcement for that. You know, we've heard, for example, some employees could still be fired even if they're granted a medical or religious exemption. So could you explain that a little bit too?
Yeah, Lacey, Kristen, let me turn that to one of you so you can follow through. I think the one key message I would say is that we want to, the good news is that we've actually had an incredible number of our workers, and remember, Department of Health also have our own staff who have this requirement. And so we have not had as many requests for exemptions as you would think. We're still obviously gathering, and there's still time for that process. But I think that what's heartening to me is the fact that I think for the most part, people are understanding why vaccines are important. And that is really key for all of us. So with that, Lacey, Kristen, anything you want to add?
Yeah, I just at a very high level. So, you know, the really important thing here is when an employee submits their exemption, you know, there is a one-on-one process that happens with their agency, as there is with any accommodation, to see if there is a reasonable accommodation that can and should be made. And, you know, verifications are coming in for those people who are vaccinated, and the accommodation process will start within each employee's agency as those exemption requests come in, and will be handled on a one-on-one basis as they typically are.
All right, our next question comes from Nathan with Prim.
So we have a lot of folks in Eastern Washington who are struggling with test accessibility, and there's a lot of people, struggling to find rapid tests for travel, concerts, etc. Are there any plans to bring back mass testing sites in Eastern Washington, and if not, why?
Lacey, no imminent plans to do that, Nathan, in a quick high level, but obviously working both with our federal and local partners across the system so that we can both understand but also recognize how important testing remains to our fighting this pandemic. Lacey.
Yeah, we have added some community-based testing sites in different parts of the state and are continuing to try to expand that access. Not huge mass testing sites, as Dr. Shaw mentioned, and a reminder that there are a number of testing at-home tests, both rapid and send-in, mail-in, that are coming online. We also have heard from the federal government that they are going to be expanding some access to testing as part of the federal vaccine or test requirements that are rolling out. So, this is being addressed on a number of fronts. I also want to note that not all schools, but many of the schools that participate in our Learn to Return program serve as an access point in their community. So again, that testing locator on our website can be helpful. Your local Department of Health may have also a list of local sites that have testing available. There are a number of retail pharmacies that provide testing on a drive-through basis, or may have those at-home tests for purchase, in addition to the traditional channels that have been around, like the drive-up, walk-up sites or healthcare settings.
Corey.
All right, our final question. I'll be reading it on behalf of Keith Eldridge with COMO. So, what does Department of Health say to firefighters and other first responders who do not want to get vaccinated, even if it means putting their jobs in jeopardy?
Yeah, Corey, thanks. And Keith, thanks for the question. I think what we've been saying throughout is we have been and have to work together to fight this pandemic. And the only way for us to fight this pandemic is to not have the temporary tools, but to have the more longer lasting tools, such as vaccines. And so last year, before we even had vaccines in our state or in this country, all of us said, gosh, if we just had a tool that we could use to fight this pandemic, let's do everything we can. And as a country, we did everything we could to develop vaccines and also to get those vaccines out to people. We went through an inordinate amount of efforts earlier from December forward through the spring to really reorganize again to do everything we could to get vaccines out to people. Vaccines are free, they're safe, they're effective, they're right down the street from you. Anybody who's eligible can get vaccinated. So when we go through all these efforts and we say that to fight this pandemic, vaccines are a key to the future, when you hear certain people saying, look, I'm willing to lose my job, I hope you will reconsider that. I hope you will talk to your healthcare provider. You will talk to a Dr. Lindquist, or you will talk to a Dr. Mitchell, or you would talk to a Dr. Shaw, or you would talk to a nurse that is also your trusted confidant. Talk to someone who you trust and have that conversation about why vaccines are important. I know a lot of people have taken this on as being a freedom issue, But ultimately, this is about, we're trying to be free of disease. We're also trying to fight a pandemic. And so I would just encourage everybody to have that conversation. Ultimately, we do not want anybody to lose their job. We want people to see why vaccines are so important and so critical. So from our state Department of Health standpoint, we're going to say the very key thing, whether it's required, whether it's encouraged, whatever it is, from our standpoint, it is absolutely critical that people do the right thing so we can fight this pandemic.
This concludes the question and answer segment of our briefing. Secretary Shaw, closing remarks?
I just want to say, look, we're in this together. We're doing everything we can to fight this pandemic. And I would just remind everybody, we can't do it alone. We've got to do it together. And, you know, just as we've had common enemies before, we've always had to come together. That's exactly what we have to do here. And I would just encourage everybody to work together, work with us, work with each other to fight this pandemic. And I come at this not as your Secretary of Health, but I come as a healthcare provider. It is a very difficult time in our healthcare system, and we cannot fight this pandemic alone. So please help us. And while pumpkin spice lattes are important to thank everybody, the really way that you can really thank people in our healthcare system is to get vaccinated, wear your mask, and do the things to really help support that system so it's decompressed. So I would just say thank you to all of you, our media partners, our community members. And I want to thank Dr. Mitchell again for joining us today. As always, Steve, thank you for your insights, and everybody on our team who, again, has been working tirelessly across the system to really assure that we never get to the point where we have to utilize very difficult ration type of decisions. We're doing everything we can, but we ultimately can't do it without the help of our community members. So with that, Corey, just remember, mask up, get vaccinated, don't hesitate, vaccinate, and certainly do everything you can to work with each other to champion good information. And we're going to do everything we can behind the scenes at the state to help support what's happening in our healthcare system. So Corey, with that, I'll turn it to you to close.
This concludes today's media availability. I'd like to thank our panelists and for sharing their time with us today, and for TBW for hosting today's live stream and archives of past briefings, including a recording of this one. Thank you and take care.